We are developing the world's first surgical robot for femur fracture surgeries. 1 out of 4 patients over the age of 50 die within 1 year after these surgeries, and we are going to improve patient outcomes and save lives by improving alignment, reducing reoperations, and mortality rate. Femur is the longest bone in the body, and it has an elongated and complex anatomy, and we have the strongest muscles around femur. So performing this surgery is very challenging. We interviewed more than 50 patients with broken legs, and 40% of them mentioned we feel we have a shorter leg after the surgery. So you see that the problem is real. So they have leg shortening or malrotation, which also causes, a permanent pain or walking problems. And that's why we need to have these repetitive surgeries to correct the problems, from the first surgery. But they cannot align the bone correctly during the surgery, and they fix it. And then when the patient is out of the operating room, the patient sees he or she has a shorter leg or a rotated leg. Because there is no measurement tool in the current manual surgeries, they cannot use any technology to help them to have a proper alignment. In order to improve the patient outcomes, we came up with this technology, which is a robot-assisted basically surgery. We will have minimally invasive surgeries. There will be no more scars on the patient's leg, just a few holes. So, which means we would have a faster recovery time. We would have a consistent technology, and so this way we will have much more improved alignment with much more accuracy within the range of sub-millimeter. So this way we will improve the alignment, which means we will eliminate those reoperations, and also we save patients' life by having the less complications and improved surgery. Basically, this minimally invasive technique will result in less risk of infections, less blood loss, less X-ray radiation on patient and medical staff, and faster recovery, and obviously improved alignment. We need to have 6 degrees of freedom in the space to move the bone. You need to have 3 rotational degrees of freedom and 3 translational degrees of freedom. And you need to have 6 actuators to have 6 degrees of freedom. So in order to have 6 actuators, conventionally you would need to have 6 arms to have 6 actuators. What we have here is only 3 arms, but we have 2 actuators per arm. So we still have 6 degrees of freedom, but with only 3 arms. And if you have less number of arms, you would have a much larger workspace. So that's one of the advantages of this technology. So Thomas Edison is the greatest inventor of all times. I think it's an honor to get an award on his name, and it's an honor to be here and to have my invention here.